I want to get your thoughts on ivermectin and how it's obviously if it's a fermented product, and correct me if I'm wrong, from Streptomyces avermatilis, and and correct me if this is incorrect, but you stated in a hypothesis that you believe, since it is a fermented byproduct of that, which is the same phylum of Bifidobacterium, you believe that the ivermectin would be a prebiotic to help replenish that Bifidobacterium.
That was my hypothesis right at the beginning, because I was seeing patients with and I don't know, and others have shown it, where their oxygen saturation was really low, and when I gave them ivermectin, their oxygen improved. So the hypothesis was, are we improving bifidobacteria by giving ivermectin, right? That was the hypothesis. We later then published an abstract where we showed that if you give patients ivermectin, the bifidobacteria goes up in about 20 patients, right? So from there, the problem is that's within 24 hours. Remember, the half-life of ivermectin is not long. It's a short half-life, so you have to keep giving it. So the problem with ivermectin is, how long do you have to keep giving it? It increases it within 24 hours, but then it drops back down again. So are you supposed to keep giving it long-term? Are you supposed to keep giving it at that dosage long-term? Certainly high dosage of ivermectin can possibly cause problems. We've certainly seen side effects of high dosages of ivermectin on the front line. I have anyways, and I'm not afraid to talk about it because I was the one conducting the clinical trials with the FDA watching on ivermectin, doxycycline, zinc with that was Dr. Barodi's and I protocol that we submitted in August of 2020. Ivermectin could increase. The problem is, how long does it increase it for? Does it continue to increase? What happens when you stop it? Is this a lifelong medication you need to take? And at what level do you need to take it? At what level does it become toxic? Those are questions we need to study and we need to understand.
So what are your thoughts around the cancer correlation in ivermectin, how it's helping?
So we proved that, we showed that loss of bifidobacteria occurred in cancer. So is ivermectin increasing the bifidobacteria in those cancer patients? Maybe, but it needs to be tested. And, I'll tell you, I'm excited to work with Dr. Ladapo in Florida because he's going to start looking at ivermectin in cancer. We need to do the stool testing. We really need with my lab, not because I want to sell my lab, but because we do have what I feel is state-of-the-art technology and reproducibility to show these microbes properly. So I think it's important to look at it. I think it's important to see at what level do we give the ivermectin? At what level do we decrease it? When is it safe? Think about what we do with patients with asthma, right? That we give prednisone. We don't give 40 milligrams of prednisone forever, right? Because we realize that if we give 40 milligrams or 60 milligrams of prednisone forever, these patients are going to start swelling up, being cushingoids, having water retention, being irritable, aggressive. It's going to destroy their bones. So we started weaning off, right? We started saying, you know what? Maybe we're on 40. Now the asthma is gone. Let's wean off to like 30, 20, 10, 5. And then when it's safe, you kind of remove it, right? But here with asthma, it's easy. You have a marker. You could do pulmonary function test on these patients. You can examine them clinically. With ivermectin, it's not so easy because what are you going to do? Are you going to do a colonoscopy every month to look for the colon cancer if it decreased, or a CAT scan? You could do a blood work, the CEA, but is that sensitive in a patient? So a stool test would be important to at least see, are we still maintaining that bifidobacteria level? We're coming out with data with cancer and bifidobacteria that if you improve the bifidobacteria, that a tumor in a guy with a head and neck cancer shrunk. So I'm working with Dr. Mackis. I'm working with doctors that are really courageous and want to see and want to innovate, right?